My name is Brenda, and I received a heart transplant 3 years ago. My journey began when a heart biopsy determined that I had stage 4 amyloidosis that had destroyed my heart, and I only had a few months to live. Before my heart transplant, I was a very active lady, doing all kinds of sports and physical activities, and slowly I was unable to even walk across a room without having trouble breathing. And since my heart transplant, I'm back to being able to enjoy life and do wonderful things that I enjoy, such as being with my family and my grandkids and swimming and snorkeling and enjoying my horses and my pets and all my friends and being able to go out and have fun. And all of this is due to my second chance at life from my heart transplant. The most difficult part of my heart transplant journey was issues with rejection. I had lots of issues with rejection in the hospital. I had several procedures to help me with that, IVIG, plasmapheresis, all kinds of different procedures to help me. Uh, Many people don't have as hard of rejection issues that I did, but I had quite a few, and that was hard. And another difficult part of transplant is the rejection meds. Um, you have to have them to save your life, to keep your body from attacking your heart because it's a foreign object in your body. The rejection meds have lots of side effects. Some people have more than others. They can cause skin cancer, so I still go out and swim and do things outside, but I wear my rash guard. They can cause shaking. They can cause, of course, we have no immune system, so a little virus that wouldn't affect anyone else is very hard on us. So you have to be careful when you go out in public and just be mindful of that. And then take your meds. I have an alarm on my phone 3 times a day. Take your meds at the same time every day and take them every day. That's very, very important. What kept me strong and hopeful during my journey was, of course, the love and support of my family. My husband was wonderful. My family and my friends were wonderful. The doctors and nurses were great. I had pictures of my family in my hospital room that always reminded me what I was fighting for. And my faith kept me going. And I cannot stress enough how important it is to be positive and have faith and be strong and keep going. You can do this. Since my transplant, things I do to stay healthy is always try to be positive no matter what is happening. I do my physical therapy every day. I ride my recumbent bike every day. I try to eat healthy. I always enjoy time with family and friends. I try to get out in the fresh air as often as I can and be as active as I can. The hardest adjustment that I have after transplant is taking those meds 3 times a day, setting my phone to take those meds, some of the side effects of the meds, but it's all well worth it and you can do it. And another thing that was hard for me is avoiding crowds. I'm a very, very social person and love to be out as much as possible with as many people as possible. And now I'm just very careful when we go to a restaurant. I always try to sit in the corner, not in the middle of the restaurant where people can breathe or cough on me or anything. We go out and I always choose the corner table away from people. I try to avoid big crowds, and most of my family and friends know they can't be around me if they're sick or have any bugs. So that was the hardest part, but it's well worth it. Okay, when I received the call that a match had been found, I can't even describe the emotions that went through. That's one reason I chose to do this video outside with sunglasses on, because every time I talk about it, I cry. It was the most wonderful yet scariest feeling in the world when I got that call from my transplant coordinator. We've got a match. We've got a match. And of course, the first thing is joy. My life's going to be saved. Thankfulness. So thankful for my donor making that choice. And fear that my heart's going to be taken out and another person's heart put in my chest. So you have feelings of joy, thankfulness, fear, love, all of these things when you get that call. It's incredible, and it's very, very emotional. And like I said, it's wonderful, and every emotion that you experience through this is well worth it. It's just a wonderful, wonderful chance at having a new life. Okay, describing my recovery. My recovery was very difficult. I had lots of issues with rejection. I was in the hospital for a long time, but I had so much incredible support from all the doctors and nurses, procedures, my family, my husband, my friends. Through a difficult recovery for many months, I'm okay. I'm 3 years post transplant now. I just had my 3 year transplant anniversary in April, and I'm doing well. Um, I'm doing well, but I'm also fighting amyloidosis, uh, which most transplant patients don't have to fight. So I have a few more complications with that. I'm on chemo. I've been on chemo for 3 years to fight the amyloidosis, but they're giving me a break now. I'm stable with my amyloidosis, and my heart is doing great. It's working hard, and I feel feelings I can't even describe. My faith is so important to me, and I feel like I got my miracle, and I want to take care of this wonderful gift that's been given to me. And every day I thank my heart donor for making such an incredible decision to donate life. And I thank my family, I thank my husband, my friends, and all I can say is my feelings of thankfulness and love and joy are overwhelming.